Today we're going to be discussing assessment of ocular muscle balance, and we're going to do this over 3 steps. So the first step is to exclude apparent or pseudostrabismus, and this can be done using the Hirschberg corneal reflex test. So first we're going to fixate Dr. Lamia's head, make sure that she can see the target. Can you see the light, Dr. Lamia?
Yes.
Good. So now we're going to be assessing the reflex of the light on the cornea, and then make sure that it's centered in both eyes, and it's centered right here, which means that our patient is orthotropic or straight in the primary position. If the eye is deviating inwards, this is called esotropia. So the reflex would be temporal or outside the center, and the opposite is true. If the eye is deviating outwards, this would be exotropia. So the eye would be centered inwards. All right, so now that we've assessed that this is true or pseudostrabismus, we're going to be assessing the presence of atropia, and this can be done using the cover test. So first we're going to be covering one eye. Make sure that it's completely covered. Make sure that you tell the patient to fixate on the light. Can you fixate on the light, please? Can you see it? Good. So we did not note any movement in this eye, which means that this eye was orthotropic from the beginning. I'm going to assess any movement in the uncovered eye. So now that there is no movement, which means that this eye is also orthotropic. If I found that there was movement, then it's either esotropic or exotropic. And then we're going to do the same in the other eye. Cover this left eye. This eye did not move. It's orthotropic. And then I'm going to uncover this eye. There's no movement. So this is the second step, which is cover test in order to detect tropias. The final step is doing an alternate cover test, and this is to detect phorias. This can be done using alternate covering of both eyes and telling the patient to keep fixating on the target using the uncovered eye. So please keep fixating on the eye. Can you see it? Good. So I'm going to move my hand. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4. Keep alternating your movement and check any movement in the uncovered eye. If there is any movement in the uncovered eye, then there is phoria. If not, then the patient is orthophoric. So we do not detect any movement in Dr. Lamia's eyes under cover, which means that she's orthophoric. And this concludes our assessment of normal muscle balance.